Hello there. Next on the list of vascular diseases in extremities is the acute limb ischemia, or they call it ALI. For the pathophysiology, ALI is defined as a sudden loss of limb perfusion and is applicable for up to 2 weeks after initiating event. It occurs when an arterial occlusion suddenly reduces blood flow to the arms or to the leg. What are the possible causes? It can be cardiac or arterial embolism, thrombosis in situ, dissection, and trauma. For clinical manifestations, we should remember the 6 P's: pain, paresthesia, pallor, pulselessness, poikilothermia, and paralysis. Again, 6 P's: pain, paresthesia, pallor, pulselessness, poikilothermia, paralysis. We can categorize into 3 the acute limb ischemia as clinical category of ALI 1, ALI 2, and ALI 3. For clinical category 1, this is considered as viable. 1 is viable and not immediately threatened. Again, not immediately threatened, and findings: there's no sensory loss and no muscle weakness. And for Doppler signals, there's audible arterial signal and audible venous signal. For type 2, it is divided into 3: threatened, 2A and 2B, marginally, 2B immediately. For the 2A, marginally, it is salvageable if treated promptly. For the findings, there is minimal or no sensory loss, no muscle weakness. In Doppler signals, it is often inaudible arterial signal and audible venous signal. But for type 2B, immediately, it is salvageable with immediate revascularization. Findings: more than toes, sensory loss, rest pain, there's mild to moderate muscle weakness, and for the Doppler findings, usually inaudible arterial signal and audible venous signal. For the ALI 3, it is irreversible. There's major loss of permanent nerve damage, and for the findings, there's profound anesthetic, profound paralysis, or rigor. In Doppler signals, there's inaudible arterial signal and inaudible venous signal. Okay, for the management, start with intravenous heparin, unfractionated heparin immediately to maintain prothrombin time of 2.0 to 2.5 times control values to prevent propagation of thrombi or recurrent embolism. You can also give supportive measures such as analgesics. Positioning: feet should be lower than the chest and keep in warm room. Again, feet should be lower than the chest. And there are different stages. For stage 1 or 2A, may do imaging first, then revascularization such as endovascular, surgical, or hybrid. For 2B, stage 2B may do imaging if it will not cause delay in emergency revascularization. And stage 3, amputation. So that's it for acute limb ischemia. Thank you.